Hello, everyone. Welcome to the Dental Hygiene Basics podcast. My name is Dana. I'm your host, and I am super excited to have our amazing guest, Jazz, with us today. So, Jazz, we met online. You have an
Yes.
incredible page,
Hello.
Teach RDH, helping students kind of get ready and prepare for the board exams. And I'm just excited you're here to share your story. Before we really dive in, the first question I always like to ask is, what is your RDH origin story? How did you decide you wanted to become a dental hygienist?
For becoming an RDH, so I always knew I wanted to get into the dental field. So back in sixth grade, crazy, right? It's like, how did I even know? But just watching people smile and being able to help them take care of them, I was like, all right, I want to do something with teeth. So I'll be honest with you, my initial goal was like, all right, let's get into dental school. So I did my 4 years of undergrad, got my bachelor's in biology, minor in chemistry kind of thing. And I was like, all right, do I want to go to dental school, right? I have to take the DAT. And then I actually shadowed at a dental office, and the dentist was like, why don't you try hygiene school, see if you even like it? Because I hadn't shadowed prior, I had no assistant experience at all. So I was like, all right, let me take a shot, apply to dental hygiene school. I got in and I was like, wow, I love this, you know, um, especially not being in a lot of debt, right? With dental school, I was like, debt's not as bad. And then that whole journey, like I became a whole new person and I've loved it ever since. And then, eventually getting into education, pursuing my dreams. I'm like, I love it, helping people, creating smiles and helping students along the way kind of thing. Yeah.
Yeah, I love that so much. Okay, so I like that, that dentist, is probably like, oh man, another one
Yeah.
turned to hygiene and stuck
To
stayed
hygiene.
there, right? It's such a great career. And I was the same way. I thought I wanted to go into dental. And then when I got into hygiene, I was like, nope, this is exactly where I'm supposed to be.
Yeah.
It's just the best feeling when it all comes together like that. Well, that's so exciting. So where did you end
Yeah.
up going to dental hygiene school?
So I went to the University of Pittsburgh. So originally I'm actually from England and I moved to America when I was in high school. And I got my undergrad at University of Pittsburgh as well. And they have a dental hygiene program and it's actually in their dental school. So that was a really cool experience. And I applied, got in. And that's the only school I applied to for hygiene school. And luckily I got in. And it was a 2 year program, whatnot. And honestly, it flew by.
Yeah, it goes by
Yeah.
quick. I know. So, thinking through, because you mentioned you had a little bit of shadowing, but no other dental experience. So, what do you think made your application stick out to help you get in on the first try?
I think just because I did my undergrad at University of Pittsburgh, I think, that kind of helped a little bit too. And then just coming with a biology degree, I want to say helped too. And then the whole interview process as well. I don't want to toot my own horn, but I was like, I probably made like a good impression, right? With the questions that they asked and getting the feel for it, whatnot. And anything extracurricular, that I did do some volunteering and stuff too. But I don't want to say I super stood out compared to any of the other students. And I
Yeah.
think it was just having a good interview process. And I think definitely having a degree somewhat helped. Maybe I'm thinking, as an educator, what would I want in a student, right? Or not, who would be like a good candidate to be in a hygiene school, right? Showing, having the passion
Yeah.
for it, right? Prior experience or even education. So, like they come with a strong background of studying, maybe, right? And having their dream of becoming a hygienist, but definitely a plus if you do have dental assisting because things might be a little bit easier to understand or dental terminology.
So, you mentioned that you had a degree before. Did you have a bachelor's in biology? Is that what you did?
Yeah, I had a bachelor's in biology before I went in. Yeah, because the goal
Wow.
was dental school. I was like, all right, I have to make use of this, degree somehow. Because, I do tell my students too, I was like, undergrad, college, completely different ball game than hygiene school. I didn't truly understand how to study till I truly got into hygiene school.
Yeah, I
You
agree.
know,
I had the same
yeah,
experience. Yeah, because I
same
had a
experience. Yeah,
bachelor's in biology and then went to dental hygiene school. I think I worked out a lot of kinks in my undergrad,
yeah,
like figuring out just the process and like what
process.
school's like and like time management. But really locking in, like you said, it is different in hygiene school.
It's
And
different.
you have to learn really prioritization, organization, because you're juggling
Absolutely.
the clinic and the classes.
Yeah, the classes and everything. It's
So
so
much.
true. Class could vary in undergrad, right? It could be 300 students, right? Or like it could be 30 students in a classroom, depending on what class you're taking. Whereas like hygiene school, you're not going to get, so many professors, instructors. You might have five, six instructors it's pretty nice because they can really hone in on you, help you, whatnot. But completely different experience, undergrad and hygiene school.
Yeah,
Yeah,
absolutely. So, getting into dental hygiene school on your first try, I think definitely you had all the things that they're looking for, the admissions
right.
committee, and I like that
Yeah,
you bring up some of those things because we do have students that are listening that are trying to get in, and it's like, well, what are they looking for? It's everything you
yeah,
mentioned, that commitment, the dedication, good grades, they do
yeah.
make an impact because
They do.
it's not to say that past performance is always an indicator of future performance, but if you perform well in the past, you probably will
Yeah,
perform well in the
exactly. I agree. Yeah,
Yeah.
definitely agree.
So once you got into dental hygiene school, what do you think was the hardest part for you?
My hardest part was, I think, time management, right? And, I even share with my students now that I'm like, when I was in hygiene school, I was single, right? I lived with my parents, which was nice. The commute wasn't too bad, right? I would park, get on a bus, and then get to school, but it was definitely time management, finding that balance, and then definitely making sure I knew how to study. Because now that you're learning the hard skills in clinic, right? But you're also learning soft skills, right? How to manage a patient, how professionalism, right? And then on top of that, now you have so many assignments, you have tests, and on top of that, the national boards eventually you're going to take, right? It's like you want to make sure that you're really creating a structure for yourself. I think initially that's where I was like, all right, how do I create structure? And I was all about within my cohort, within my class, like how can we help each other? I loved our class for that. So it was like, if I can get it down, right, how can I help someone else kind of hone in and get it down too? But I think
Yeah.
creating that structure initially is the hardest.
Yeah,
And
it
once you got
is.
it down, you got to stick to it. But it depends on the program too. Accelerated programs, it's a quick blink of an eye. Whoa, it's next time again. Whereas like at the University of Pittsburgh, also it was a 16-week semester, so that was really really nice. You truly got to retain information, repetitiveness, and whatnot. I think creating structure, time management, and finding that balance is definitely key while you're in hygiene school.
Yeah, I agree. I mean, both of us have very similar shared experiences. We both
Yeah,
went to university. We both taught at accelerated programs, and
yeah,
you see the difference between the two. And I know that both can put out very highly qualified, ready to rock
right.
clinicians. And they both
Absolutely.
differ in their benefits. There's pros and
Yeah,
cons, I think, to each. But considering thinking about your students and what they're going through with these rapid
yeah,
terms, like 10 weeks, that they have to wrap
yeah.
everything up.
Uh,
What do you think is the biggest struggle for your students who are going through accelerated programs?
So definitely with accelerated programs, retention, right? Like you said, it's week one starts, and especially like subjects like pharmacology, pathology, right? It's like they're kind of trying to pump everything up in their brain. And once that 10 weeks is done, they're dumping it out. And that's where, especially for the national boards, right? So especially in California, they're not mandated to take their clinical exam anymore.
Yeah.
So, it's the national boards is what they're really relying on. How do we teach these students to fully retain the information so they're not doing the double work when it comes to that very last term? So it's especially with them, it's not just the balance, it's creating a study structure. And a lot of these students that do come into these accelerated programs, they might be parents, they might be working as well. So that's where I do see the struggle is finding that balance and that time. And I do tell them it is a short term sacrifice. 2 years is going to go by so quick. So when you do get breaks, right, enjoy the time with family, right? And like we're all human, we all burn out. I tell them that's one thing I think as an educator, you relate to your students, right? They see the passion as well. We all burn out, right? I've been whacked days where I'm like, oh, I just want to put my feet up, but no, I have to grade, right? So it's like take a break, take a breather, whether it's, I'm not going to do anything tonight or this weekend. I'm going to prioritize and just self care because I've already done what I needed to do, right? And just recognizing like you're only human. You'll get through the 10 weeks, you'll get through the 2 year program, short term sacrifice, but just don't burn yourself out because then you're just digging yourself in a deeper hole kind of
Yeah.
thing.
Yeah, I agree. And I think with burnout, a lot of times, I think hygienists are very prone to it for a number of
Yeah.
reasons. But
Yes.
also, in my personal experience, we don't learn the lesson the first time.
Yes. I
Like
agree.
you build this habit of burnout, and then you're like, okay, you take a break, whatever. And then you're like, okay, I'm better. And then what do? You just go back and repeat the same cycles.
Back
Got you
to it.
there.
Yeah. And we definitely see that, right? With hygienists, we're very type A.
Yes.
We like to plan, we like to be organized. Most of us, right? Where it's like you
Yeah.
know, we try to get ahead of the game, this, that, and it's like, it's honestly, you create burnout unless you create that balance.
Yeah. And I love what
Yeah.
you mentioned. Jazz, you do national board tutoring. You run the course at your school. You teach the national board course
Yes.
at your school, but also you're helping students who have struggled with the national board, which I do also. And I think I really resonated with everything that you're saying that these students are having trouble retaining the information. Like they may learn it and they may pass the class, but then it's
Right.
that instant brain dump because they're automatically moving on to the next thing. And that's really challenging. So I know for me, I kind of want to challenge students no matter what program you're in, because it's really easy to just get it in and let it out, right? But
Right. Exactly.
starting to make those connections between subjects, like starting to think,
Yeah.
okay, I learned this in anatomy and now I see this in an x ray, right? And
Right.
so
Yes.
thinking of when
That's
I'm
great.
studying landmarks, I'm also reviewing anatomy and trying to piece together when you're
Yeah.
learning perio, you're also looking at anatomy, right? So
Exactly.
coming out of the gate hot with those foundational classes like anatomy
Yeah.
and radiology, it's like if you build that strong foundation up front, it's a lot of work. But in those first 10 weeks, right, those core classes,
Yes.
it's like
Right.
put in all the effort and then get the extra help that you need. I'm sure as a tutor,
Right.
you've seen sometimes people just wait too long and then
Way too long.
we're catching them at the
Yeah.
board exam, right?
Exactly. I definitely see that, like currently I'm in board review right now and like we reviewed head and neck anatomy last week and it's like, I think I remember that, or oh, that sounds familiar. And it's like, you know what, like you said, making those connections, right? So when they're in clinic grading their panoramic x-rays, right? It's like you think about your anatomy, right? It's gonna tie in, make those clinical observations, even with patients with pharmacology, right? You've already had the class, you've passed it, but let's dig a little bit deeper, right? What classification of drug is this, right? The side effects, those modifications. So I agree. Definitely tying it in the whole process of care, right? And then lending those subjects the foundation and just, I tell them archive it up there, right? It will come in handy. Just don't dump it out. That way those words look familiar and you should know, right? But it's a lot of repetition. That's the way I teach is a lot of repetition to help with the retention and making those connections or memory tricks, right? To really, so you don't truly forget it.
Yeah,
Yeah.
and such a good
Yeah.
point that you made. When you're in pharmacology, you may learn it over the course of the 10 weeks. You can just ingest it and then dump it, right? But
Yeah.
where's the perfect place to practice that repetition in clinic with your patients
Right.
who are taking
Exactly.
medications? And I always suggest, I'm like, look, we know you're going to have to know ASA and blood pressure classifications for the boards. Why
Right.
not, every
And
time in clinic,
mm,
okay, what's their ASA? What's their blood pressure classification? Try and memorize it and say it out loud before you look at the chart and confirm what it is, right?
absolutely. And then you feel good inside, right? Like, oh yes, I got it right, right? It builds that
Yeah.
confidence in a sense.
Yeah, because
I
that
totally agree.
incorporates that repetition, which is so important for retaining
Yeah.
information and also active recall because your brain loves to recall information. And the more you do
Information.
it, the happier it
Yeah.
gets. It's like, yes, I know it.
I know it, yeah, and that's truly what it is, and, like, talking to you about, like, we live in such a fast-paced life now, right? So, like, even with all the other board review, right, like, they have their apps, and I'm like, "Download them, use them," right? Like, you're sitting in line for pickup to pick up your kids. Grocery line, you're waiting, right? I was like, "Make use of it," right? The more you get exposed to it, the better it's gonna be for you, beneficial, especially for the bods, and then, like you said, we're seeing patients, right? We're not gonna just forget everything we learned in hygiene school. Yes, we might not tell them, hey, cranial nerve number one does this, right? But it's making those connections and kind of keeping it in the back of your head.
Yeah.
But I agree. Repetition, active recall, it's the new way of kind of, I guess we used to do it, you know, when we were in school kind of thing, but now it's like we want it on the go, right? And a little
Yes.
bit more fast paced. Yeah.
Yeah, and that's what I tell students a lot whenever I'm just, going on my tangents about whatever it is
Yeah.
I'm talking about. And I'm always like, in today's day and age, you can Google anything or look at
Yeah.
ChatGPT and ask the question and
Exactly.
you get the answer. We've lost
Yeah.
that start from point A to point B. How do you find the answer? And on the boards or on any exam that you're taking, you are ChatGPT. Like you have to make
You
this,
have
right?
to make the connection. That's such a good
Yeah.
point. It's so
And
true.
and the best
Yeah.
way to connect those dots, I think, is to try and see the bigger picture in clinic and utilize, like, take what you're learning in class, and the best place to incorporate it is in clinic because that's where it directly, that's what you're
It
learning it
happens.
for.
That's what
Yeah.
you're learning it for. Exactly. No, I completely agree.
Yeah.
Apply it to clinic. And they're in clinic, 3 to 4 times a week. So no better way to do it.
What do you feel like is the biggest piece of advice that students need to hear?
Okay, so biggest piece of advice that I even tell my students is stay open to learning, right? As a student, sometimes we might have a bad day in clinic, right? Or we didn't get the grade we wanted, but hey, every mistake you make, it's just going to make you a better clinician, student, whatnot. But always stay open to learning. Never close yourself off, kind of thing. And even to this day and age, right? I'm sure you can agree too. We're continuing to learn, right? We're looking for opportunities, but stay open to it because you don't want to close yourself off because then you're just going to be stagnant. You're going to be stuck, right? Whether it's for us, it might be like different CEs, learning so much from you, from your page too, right? But stay open even in hygiene school, right? And don't just get fixated on this is the way it is. It's going to has to be this way, pick your instructor's brains. Some of them might be have been doing this for like 20 years, 30 years. Things do change, but stay open and, kind of pick brains, pick your classmates' brain, right? Like, hey, how do you study? Or what works for you? Or hey, what would you do with this patient, with your instructors? So that's the number one thing I say. Stay open to learning and continue to learn. Never cut yourself short.
That's such a great
Yeah.
advice because, yeah, the learning doesn't stop. I talk about that all the time, but I think sometimes naturally we can resist the learning or we put up walls around ourselves
Yeah.
when it's either hard or maybe you disagree or someone does it differently than you. Hygienists, we do tend to have very regimented
Yeah.
thought patterns. And when
Right.
the way we learned it or the way we understood it is the way it is and it's supposed to be. And that's
Right.
why we have such high standards of care, which is a good thing,
Yes. Which
is
is a good
why
thing.
we take such good
Yeah.
care of our patients, but also it can sometimes block us and prevent us from gathering an outsider's perspective on something a little bit different. And sometimes that can come from, differences between students and educators. I know sometimes I could tell when a student just had a wall up and you're like, just let that down a little bit, like just
A
a
little
little
bit.
bit, right?
Yeah.
And they need to
Exactly.
see what's possible. So, what do you think is one way, thinking about now, you are an educator, you've been a student, what would you tell the student who's maybe, and I say this because on socials, you see all the negative posts about students and
Yeah.
like their instructors are like, dental hygiene school is awful, it's a nightmare. My
Well,
instructors are the worst. Like, tell them what an instructor is really thinking, right? Like, you're not
yeah.
trying to harm them. What are instructors really thinking?
So as an instructor myself, right, as an educator, I'm thinking, okay, so I have a class of what, 28, 32 students. Right? I try my best to make it as personalized as I can with my class or even clinic, right? But I'm like, how can I get them to think a little bit deeper, right? Help them critically think, how can I help them grow? It might not be the requirement you want, right? For a sign off kind of thing, right? Or not what you wanted to hear as an answer. Hey, want you to see this perspective, right? And I think sometimes when students do get into dental hygiene school, it's like, oh yeah, we just scrape teeth kind of thing. And like, it's no, you're not. You're an all-in-one healthcare professional, right? You're not just cleaning teeth, you're educating patients as well, right? You're making those connections, making those links. You're collaborating with the doctor, other team members, right? So as an educator, I don't want to just teach you the hard skills. I want to be able to teach you the soft skills as well. We don't realize it, how much of an impact it makes, whether it's on a patient, a doctor, an employee, fellow hygienist, right? So I'm not just looking at, oh yeah, let me just sign this off for you because you need it for your requirements or you need to pass an assignment. It's like, you know, are you learning something? Are you retaining it? How about, I don't see myself as like, yes, I'm higher than you, I'm your instructor kind of thing. It's more of like, one day you're gonna be my coworker, we're gonna be in the same field. So how can we collaborate professionally in a sense? So it's not like we're out there to get you, right, knock you points off on that. It's like let's help you engage, critically think, and gain those soft skills as well as, scaling, right? Or how to do a perfect IA kind of thing, and how to just manage that as
Yeah.
well.
Yeah, absolutely. No, and when hygienists get out and then you see the passion that they have for the field, there's
Yeah.
all sorts of things going on legislatively within our
Yes.
career and our profession. And you see
Yeah.
hygienists, they're fired up. We're like, we were taught this standard of care for a reason. You're like, you're all fired up
Yeah.
about it now. But when you were in school, you were like,
So
why are
yeah,
they so strict?
exactly. No, I completely agree, and I think especially with an accelerated program, right, things go by so fast, right, and getting the requirements done. And to this day, I have my students that have graduated, right? They'll message me like, "Hey, what would you do with this patient? Or what do you think?" Right? And it's a great feeling. And then I tell my now students like, "Hey, this is why I'm telling you this because I don't want to get a text message, of 2 months later, like, hey, what should I do? Right. That's why I'm trying to make those connections with you now. So that way you get the experience and because you're going to graduate soon and you're going to have to be making those calls yourself, right?
Yeah.
Especially if you don't have a fellow hygienists. It's like, you know, get those skills now. Everything's a learning experience, whether it's the way you want it or don't want it, right? We always want the best for the patient. As an educator, yes, I want the best for you, but don't be close minded.
Yeah,
Like,
I agree. I know the students that I feel like always take the most out of the learning situations are the ones that are really like soaking it up and
yeah,
they see how the material that they're learning is going to directly impact the career and their career and then also the care that they're going to provide, right? It's twofold.
exactly.
And I always just think,
It is.
if you just want to go out there and clean teeth, like sure, you can do that.
Yeah,
But do you want to get out there and change a life? That's where
right.
you really start digging in deeper and, like you
Yeah,
said, making those important connections now. And there's just so much room for growth and opportunity as
yeah,
hygienists. I mean, we're both experiencing it,
yeah.
kind of
No,
moving into education, right? It just feels like the sky is the limit right now when it comes to what's possible for hygienists. And I'm excited for our futures, our careers, and to see what's possible. And I think that's why we pour so much into,
right.
the future.
The future, exactly, we do because like yeah, the sky's the limit. Things are always changing, right? Even with science, right? Like think about like I mean legislation, fluoride, right? There's been controversy with that. Now we got nanohydroxyapatite, right? So it's like things are always changing. Get those skills,
Yeah.
as you can and you're changing lives, you're helping people, right? And clearly remember this from my hygiene school instructor, right? She was like, I saved a life. I was able to, see something during an E&I examination and it ended up being cancer, right? And the patient was so thankful. That really stuck with me in hygiene school because going in dental hygiene is like, yeah, we do clean teeth, right? Yes, there's systemic connections, but I remember just sitting in the class and thinking, wow, like we do so much more. We're not just cleaning teeth, we're healthcare professionals. We look at those patients from head to toe, basically, right? As soon as they're walking that door, we see them maybe 2, 3, 4 times a year. So it's like, you're truly changing a life,
Yeah.
We're therapists too, right?
Yeah.
We're all in one kind of thing. So don't cut yourself short, as being a student, like just gonna go out there, clean teeth, make some money, and you make an impact.
Yeah, something I heard from another hygienist, her name's Stacy Wiseman, and she talks a lot about like nutritional counseling and things like that. And
Yeah,
I'm pretty sure it was her that mentioned this, but either way, someone shout out to whoever said this, but they were basically like, you learn all these classes in school, and those are the classes that you are qualified to educate your patient on and practice to the full extent of your scope, right? Like you can give your
right,
patient nutritional counseling. You could see maybe they have an iron deficiency. You could see maybe they
right.
have a B12
Yeah,
deficiency. You're not saying you have this deficiency, but you're saying something is off here and I
yeah,
think you need to get this checked. And just having that knowledge, and that starts on day one of dental hygiene school, coming into it with that mindset of
right.
I could find things that could be overlooked by everyone else, right?
Everyone else.
Really, really
Yeah.
incredible.
No, definitely. And especially now with the population of patients, right? A lot of patients haven't been to the doctor since COVID, or pre-COVID. And it's like they might come in for the teeth cleaning, right? Because they've had that rapport with their dental office and you're just making those connections. A lot of patients did go into mental health, depression, anxiety, and we can see that. And then the big thing is collaboration, right, with other medical professionals.
Yeah.
I think sometimes we forget about that. We're professionals too. We can make the calls of like, go see your doctor, or some offices might even be linked with, medical offices. So, kind of making those links as well, connections.
Yeah,
Yeah.
absolutely. Yeah, such great insights today. I
Yeah.
appreciate your time so much. So, I would love
Yeah.
for you to just share where students can find you if they have more questions where they can reach out and ask them.
Yes, so definitely on Instagram, TikTok at teachrdh. So, send me message on there. Feel free, for tutoring or just any questions about me, right? Or any kind of study tips. I'm very open to that.
Thank you. We need all the
Yeah.
help we can get because I know there's
Yes.
so many students out there that are always looking for extra help and resources. So we're so thankful to have you as a resource. And thanks for
Yeah.
the joy and love you put into the world as a professor.
Yeah.
It means so much.
Yeah. No, thank you so much for having me, Dana. I
Of
appreciate it.
course. Thank
Yeah.
you.